Before February 1, 2019, patients came to the hospital at the brink of death, needing dialysis. The reality of the situation is that from so many perspectives, this needed to change. I honestly didn't expect to change health policy this quickly. I'm Lilia Cervantes, and I'm an internal medicine hospitalist and researcher at Denver Health and associate professor in the Department of Medicine at the University of Colorado Anschutz Medical Campus. My parents were Mexican immigrants. They wanted me to have the opportunity to pursue any kind of career I wanted to. From a very young age, I knew that I wanted to be a physician, basically wanting to improve the well-being of my community. I grew up in a neighborhood that's very poor, where the life expectancy is about 12 years shorter from a neighborhood that's just 5 miles away. For patients that don't have access to care, they have to be in our emergency department at the brink of death. And Hilda was one of them. Hilda was undocumented and didn't have access to care. She had end-stage kidney disease and couldn't access the needed 3 times per week dialysis for her kidney failure. What touched me about her was that she had 2 small children and she was young. Her kids were worried that their mother would die. They were worried that no one would be around to call an ambulance if her heart stopped. And she ultimately decided to preemptively withdraw from dialysis because of the emotional distress it caused her children. After Hilda passed away, I felt a lot of anger, and my anger led to determination. Ultimately, I decided to gather a team to do the research that would change health policy. As a result of sharing Hilda's story and our research, we were able to institute a major health policy change in the state of Colorado. This meant that the diagnosis of end-stage kidney disease was included in our state's emergency medical definition. Since the health policy change, Colorado Medicaid has announced that they predict that they will have a $10 million cost savings per year. This is literally saving lives. I think that if she were here today, Hilda would be so proud. Colorado is leading the change and improving care for patients that are vulnerable. It's an exciting time to be here at the Anschutz Medical Campus, addressing social challenges. I am completely devoted and invested in continuing health equity research as a means to change social injustices. We're moving the needle on health inequities and removing those barriers so that everyone has the opportunity to thrive.